In the movie A Silent Voice, the protagonist Shoko Nishimiya suffers from congenital hearing loss. She often finds herself in a bind, misunderstanding others or being misunderstood because she struggles to express herself. The classroom's noise, the boom of fireworks, sounds we take for granted, each with its own unique charm, are to her nothing but a monotonous silence. It's not just heartbreaking for everyone to see. Even I feel a deep sense of pity. So today, Jeff wants to talk to you all about the issue of congenital deafness. Hi everyone, and welcome to the Human Observation Society. According to the Chinese Clinical Practice Guidelines for Genetic Diagnosis of Deafness, 60 to 80,000 deaf babies are born in China every year, and 50 to 60% are genetic. In our population, nearly 1 in 7 people carries a deafness gene. How do these genes cause hearing loss? Could we ourselves also be carrying a gene that causes deafness? First, let's take a look at what congenital hearing impairment actually is. Based on clinical symptoms, deafness can be split into syndromic and non-syndromic types. While many of you might have heard names like XX syndrome, you might not know what syndrome really means. Like when you study calculus and know the name but not what it's for, or learn the Tyndall effect but can't tell it from a snack brand. Or watching Jeff's videos without giving a like, follow, and share. Click here, click here. A syndrome is a disease that comes with abnormalities in other systems of the body. Take Waardenburg syndrome, common in syndromic deafness. In 1951, Dutch doctor Petrus Johannes Waardenburg first noted a new syndrome where patients have blue eyes that don't affect vision, but instead cause severe hearing loss. Later, research showed that these patients might also have heterochromia, or changes in skin and hair pigmentation as clinical symptoms. Some clever folks might think, wow, different colored eyes and white hair is so cool, and want that look for themselves. Well, if you really want to look like that, it's not hard. Time travelers with superpowers should know the trick. You just need to go back to the embryo stage and use a power-up to break the genetic lock, causing mutations in genes like MITF, PAX3, and SOX10. This controls your neural crest cells, stopping them from developing normally. It's quite simple. Since melanocytes, auditory nerves, and colonic cells all come from neural crest cells, these gene issues lead to Waardenburg syndrome, giving you those white hair and cool eyes you've always wanted. Since this is usually autosomal dominant, each of your children will have a 50% chance of inheriting the condition. If your kids knew you lost your hearing just because of a chunibu phase, that would be quite a wholesome family moment. Maybe just try colored contacts and hair dye instead. Don't go traveling back in time to power up, okay? As for non-syndromic deafness, it rarely affects other organs like syndromic types do. It mainly damages hearing. This is the most common hereditary deafness, with many inheritance patterns and pathogenic genes. Patterns include autosomal dominant, autosomal recessive, X-linked, and maternal mitochondrial inheritance. Take the common GJB2 gene mutation. Most patients are born with severe or profound sensorineural hearing loss, which is congenital. A few start with mild to moderate loss at birth, but it worsens over time into severe hereditary progressive deafness. It's very similar to Nishimiya's case. As a child, she could hear some sounds with hearing aids in both ears, but as she grew up, she became completely deaf in one ear. In most cases, pathogenic mutations of the GJB2 gene are inherited recessively. Therefore, even if both parents have normal hearing, if they both carry the same pathogenic gene, they might have a child with hearing loss. And that is indeed the case. A 2019 documentary on hearing-impaired children called New Sound mentioned that over 80% of deaf children are born to parents with normal hearing. What these children can do is seek early intervention like Nishimiya, learning to speak while they can still hear to avoid becoming mute. Interestingly, research also shows that 90% of children born to hearing-impaired couples have normal hearing. It seems counterintuitive, but it's actually not that hard to understand. What Jeff just said was that if both parents carry the same pathogenic gene, their offspring might be affected. However, according to the ClinVar database of the National Institutes of Health, there are currently 138 genes causing non-syndromic deafness, with over 1,000 related mutation sites. This means that even if both parents have congenital deafness, it might be caused by different types of genetic mutations. Therefore, their children won't necessarily be deaf. But it's important to note that parents with hearing impairments often can't speak normally either. A child with normal hearing in such a silent environment might not learn to speak, effectively becoming mute or developing other language disorders. So parents must be aware of this issue early on and regularly take their children for speech training with the help of doctors. There's also a special type of hereditary deafness where carriers of these pathogenic genes might have normal hearing initially, but deafness is triggered only after certain environmental stimuli. Take slap-induced deafness and injection-induced deafness as examples. If your SLC26A4 gene on chromosome 7 mutates, you might develop a congenital malformation of the inner ear structure. This is an autosomal dominant genetic disease, also known as large vestibular aqueduct syndrome. Simply put, patients are extremely sensitive to changes in intracranial pressure. Even a common cold or the pressure change from being slapped can disrupt the ionic balance of the endolymph, leading to sensorineural hearing loss. Currently, there's no effective treatment. The only way is to diagnose suspected cases early and intervene with cochlear implant surgery. Or if your mTRNR1 gene on the mitochondrial genome mutates, using aminoglycoside drugs like amikacin, gentamicin, or kanamycin, even at doses far below the standard, will cause severe and irreversible damage to your hearing. And since our mitochondria are maternally inherited, it means the mitochondrial genome of both sons and daughters comes only from the mother. If a mother has the mTRNR1 mutation, all her offspring will carry this hidden threat. Therefore, early screening for these mutations and avoiding those drugs is crucial for carriers. According to the measures for the administration of neonatal disease screening, all newborns should undergo early hearing screening. This helps identify children with hearing impairments before language development and allows for intervention. For example, direct hearing screening can rule out congenital deafness in newborns, and genetic testing for deafness can further identify children with hereditary progressive hearing loss. Genetic diagnosis methods for hereditary deafness are now very mature. Depending on the scope, methods include Sanger, targeted gene, whole exome, and the whole genome sequencing used in our version. In these whole genome reports Jeff helped produce, besides test results and references, there's also practical disease knowledge and intervention tips. If you need it, give it a try. That's all for this video. If it was helpful, please follow, like, and share. See you next time.